Good evening and welcome to Healthcheck. Now, pneumonia is an acute respiratory infection of the lungs, which when a person is infected, the lungs are filled with fluid, which results to difficulty in breathing. Statistics show that pneumonia kills more children than any other infectious diseases. According to UNICEF, a child dies of pneumonia every 43 seconds, claiming the lives of about 200,000 children worldwide. But most of these deaths can be prevented. Tonight in studio, we have Dr. Christine Shege, a pediatrician and a pediatric infectious disease specialist, to help us understand more about pneumonia in children, how contagious it can get, its treatment, prevention measures, and everything else you need to know about childhood pneumonia. She's here ready to answer all your questions. You can start texting them in. Our SMS line is 22232, that is 22232. You can also watch us live on Facebook and YouTube. Our handle is at Top TV Kenya, and you can drop there your question in the comment section. Good evening. My name is Grace Mutiso. Glad to be with you this new week as we focus on childhood pneumonia. Allow me at this point to introduce Dr. Christine Shege joining us. Good evening, Dr.
Good evening, Grace.
How have you been?
I've been good.
Yes.
Yes.
A busy day today? Or
well,
quite
very busy. I just barely made it here.
Yes.
Yes.
But we thank God you're here.
Yes.
Okay. So we are focusing on childhood pneumonia this evening, our focus of discussion. But before that, as a pediatrician, what are some of the common diseases, that you have to deal with, the parents bring in, that is affecting children?
Thank you for that very, very important question, Grace. So the commonest disease is common cold. And common cold is, as it sounds, a common cold. Yes. So it's a viral illness that is usually mild, does not need to be treated with antibiotics. Most of the time, it's just home remedies and keeping the nostrils clear, and it will go away on its own in a week or so. So that is the commonest thing we deal with as pediatricians on a day-to-day basis in children. Other common illnesses are diarrheal illnesses, also in children mainly viral.
Yes.
So also not needing antibiotics, basically needing the child to drink more, and it usually goes away on its own. So I would say that those two are the commonest things we are dealing with in children.
Okay.
Yes.
You're saying that, and I know a parent. Homa.
Yeah,
you need to
yes.
You need to get the fastest cavest and get something to help the baby breathe well, so the mucus, so the cough.
In fact, there are only two things that you need.
Yes.
In the younger children, you need some nasal salt drops, which you can either make at home, because out there in the village, they may not have access to the ones in the pharmacy, so we instruct them on how to make them at home.
Yes.
Or you can buy over the counter, because it's just salt, and you can put as many times as possible in your baby. Do not know how to breathe with their mouths. Yes. And if they are breastfeeding and their noses are full of mucus, they will not breastfeed. In the older children, the school going, the kindergarten, you need a handkerchief. That yes, is what you need.
As simple as that.
That's what you need. You need a handkerchief so that they can clean their noses. And after a few days, the mucus will dry up and they'll be as good as new. Yes, so you do not really need to keep rushing for antihistamines and to keep rushing for antibiotics, because now you feel it has gone on for too long, the mucus is yellow, so we need an antibiotic. No. Yeah, and especially if you're going for one over the counter, yes, that is a no-no.
Okay.
Yes.
Let's talk about diarrhea before we get to pneumonia. At what stage should it concern a parent to say, no, this child needs to be sorted out?
Let us maybe first start by defining diarrhea.
Yes.
Because diarrhea is not loose stool. Loose stool is basically stool that is running. As I tell my students, because I'm also a lecturer,
yes,
any stool that takes the shape of a container is loose stool. Now, for you to call it diarrhea, you bring in the issue of frequency. So if it's going on for more than 3 episodes in 24 hours, it qualifies as diarrhea. When does it become concerning? That's a good question. It becomes concerning as one, if it is accompanied by vomiting, and where the vomiting is vomiting everything. We say, like, for example, in a breastfeeding infant, vomiting everything inclusive of all breast milk. That sets up a child for dehydration.
Yes.
Because with diarrhea, what we worry about is dehydration. So if you are able to keep rehydrating this child, keeping up with the volumes they are losing, then you can manage them at home. But remember, it's difficult to quantify diarrhea because you are wearing diapers.
Yes.
So, and then many of us are working outside the home, so you may not be able to really assess. So anytime you feel concerned, go and seek healthcare. And healthcare for diarrhea is available in every hospital. It doesn't have to be a high-end private hospital. The county hospitals, the dispensaries are well-trained, well-equipped to manage diarrhea.
Okay.
Yes.
Thank you. Thank you. She's Dr. Christine Shege, a pediatrician and a pediatric infectious disease specialist. So let's get to our topic of the day, pneumonia. What's pneumonia? How do you define it?
I heard you define it very well, Grace. In fact, I thought, wow, you deserve an honorary degree in pediatrics because you said it's an acute infection of the lungs.
Yeah.
And that's exactly what pneumonia is. It's acute, meaning it is most of the pneumonias we are dealing with, the ones I know people are worried about are the acute, meaning they come in like, okay, when I say suddenly, I don't mean like an accident,
yes,
but they come in within a span of a few days or even hours. So acute, and then it's an infection. I like that because it dispels the myth that pneumonia is caused by cold. It is an infection.
Yes.
So for it to be an infection, it means there has to be an infectious agent, which can either be a bacteria or a virus. So it's an acute infection of the lungs. So let's now focus on the lungs. And I see we have nice pictures of the lungs around us. So lungs are made up of the airway in which we breathe. So I know maybe the people watching us may remember from their biology that we have there. From the nose, we go to the back of the nose. That's the upper airway. And then in the lower airway is where now it divides into 2 and then divides severally in each lung. So we have what we call the bronchi and the bronchioles, and then the lung tissue. The lung tissue is like the meat.
Yes.
So pneumonia is infection of that meat, that lung tissue.
Sure.
Which brings me to the question, because I know it will be asked, what about infection of the airway?
Yes.
For example, infection of the bronchi or the lower ones. If you remember your biology or your science, the lower ones are called bronchioles. So when we have bronchi, we say bronchitis. When you have bronchioles, we say bronchiolitis. Let me stop at bronchiolitis because that is the lower small airways.
Yes.
So bronchiolitis is a common infection in babies. Yeah?
Yes.
So sometimes when we are not able to differentiate between the two as clinicians, for example, if you're in a small hospital where you may not be able to do the exact test, you treat the child for pneumonia and bronchiolitis. So bronchiolitis is when the airway is full of mucus. Because remember, the airway is continuous. It starts from the nose all the way down. So there is no way the mucus will stop somewhere. It's continuous. And small babies are not necessarily able to have an effective cough to remove the mucus. So when it gets trapped in, they will of course have difficulty with oxygenation, oxygen delivery. They'll have difficulty in breathing because now the airway lower down is full of mucus. And now when we have the lung tissue full of fluid, that is now pneumonia. But they manifest basically the same difficulty in breathing. So I'm trying to remember the question that was now going to be begged to be answered about. So bronchiolitis and pneumonia are common infections of the lower airway.
Okay.
Upper airway is common cold. I've remembered the question that was begging to be asked. Cough. Cough.
Yes.
So should we really be stopping coughs? Now that I have said that airways need to be cleared. So airways need to be cleared, one, by either use the saline drops, use a handkerchief, or cough. So when you give a baby a cough syrup, what are you doing? You are hindering their cough.
Coughing.
So all that mucus that they need to cough out is basically going to stay in, and their oxygenation will be affected. Yeah?
Yes.
Yeah, so I know I wanted to get that out of the way as we continue. I know you have many things about knowing how can one know they have pneumonia,
Yes.
what are the signs.
Yes, that's why I wanted to get to. You had mentioned at the beginning
Yes.
that it can either be bacterial or viral infection.
Yes.
So are you able to differentiate that for us?
Yes. In fact, one thing I can tell you from statistics, because we have surveillance that goes on to know what are the agents circulating in this season or in this era causing pneumonia in children. So since 2013, the pneumococcal vaccine that covers the biggest cause of bacterial pneumonia, which is called Streptococcus pneumonia, was introduced routinely to all children in Kenya. So since that time, the biggest cause of bacterial pneumonia went down. In fact, if you go to many of the county hospitals, you will not find very many children with pneumonia as there used to be. In fact, some of the statistics you are quoting were from the pre-vaccine era. So we have had a lot of success with that vaccine. So what is the bigger cause of pneumonia now? Viruses. And which are the common viruses that cause pneumonia? One is influenza. Yeah? And influenza, we like calling it flu.
Yes.
And I wish we wouldn't call it that, because we also call common cold flu.
Ooh. Yes. And
But
they are
are two distinct things. They are as distinct as COVID and common cold.
Oh, yeah.
So influenza is a virus by itself that even the symptoms are different from common cold. So influenza in young children, infants, is the biggest cause of pneumonia. Influenza is the biggest cause of pneumonia.
Yes.
Then what follows? What follows is another virus, abbreviated as RSV. What does RSV stand for? Respiratory syncytial virus.
That's a big word there.
Yes, but you can stick with RSV.
Yes.
And remember that the first one means respiratory.
Yes.
So what does that virus do? So that virus predominantly causes bronchiolitis. Remember I talked of bronchiolitis.
Yes.
So when you see a young 4-month-old who is coughing, wheezing, has a lot of mucus, may have a fever, most of the time it's bronchiolitis.
Yes.
And if you are an experienced clinician, you're actually able to differentiate between the two, pneumonia and bronchiolitis. And I know a question that is also begging to be asked.
Yes.
So what are the signs of pneumonia in an infant?
Yes.
How will I pick that my infant has pneumonia? Because I pick from my patients, and always they worry. At the back of the mind of every mother with a young infant, they always thinking about pneumonia. Oh, they dress up the children, cover them up.
Yes.
Oh, they might get pneumonia. When a child has a cough, they come oh, check if they have pneumonia.
Yes.
So the first thing I will say, cough is not a sign of pneumonia in a young infant.
Ah.
Yes.
Is it just normal cough or consistent cough?
Cough is not a sign of pneumonia in a young infant. So what is a sign of pneumonia in a young infant? One very a very easy sign to pick, especially if you are a breastfeeding mother.
Yes.
A child who is unable to breastfeed. Unable to breastfeed because they have to stop and pant. That is one sign. And then if you examine them, you don't even need to be a doctor or trained. You will actually see their breathing pattern is off. So that's why we should wash our babies. And that's why we should basically get to know our babies so that when the breathing pattern is off, you notice. But I don't mean when the babies breathe fast, because sometimes a smiling baby and a laughing baby will be breathing fast. These babies are not smiling and laughing. They actually look off.
Yes.
So you
a bit dull.
Dull. They look dull, and then you look at their chest, it's going in and out.
Yes.
Then when you put them to the breast, or even give them some milk, they will not take it because they cannot breathe. So those are basically the signs of pneumonia. Then, of course, they may have a fever, but cough is not a sign. Running nose is not a sign. Yeah?
Yes.
Yeah, so cough usually can occur with any respiratory illness where you are trying to clear your throat. And then again, the other worry I hear from mothers is, make this cold go away because it will turn to pneumonia. It will not.
Those are myths, eh?
Yes, and misconceptions.
Yes.
It will not, the cold will not turn into pneumonia. So basically, even if the cough becomes a little bit chesty, as it usually does when the cold is about to clear, if the child is happy, maybe you've already even seen the doctor and they've reassured you, just relax. The worst thing you could do is go and get some antihistamine, because the antihistamine will stop the cough, and so all that mucus will remain trapped. And that might actually now bring other problems.
Okay.
Yes.
Wow. So remember, we are talking about pneumonia in childhood. Our SMS line is 22232. Actually, it's right at the bottom of your screen. You can also engage with us at Hope TV Kenya on Facebook and YouTube for any question that you have regarding your child or your relative's child or your neighbor's child. You know, talk to us. I'm hosting Dr. Christine Shege. She's a pediatrician and also a pediatric infectious disease specialist. So keep your questions coming. We'll be sampling them in a short while. So you had mentioned about the symptoms in, the infant.
Yes.
What about the school-going children, like 5 years, 6 years? What are the symptoms? Are they the same?
So the good thing now, here we are, previously we were dealing with a non-verbal or a pre-verbal child.
Yes.
So they can't tell you what they're feeling. But the good thing with the older child, and the type of pneumonia that they get is a little bit different. So the young infant will get more like a widespread pneumonia affecting all parts of the lung, what we call bronchopneumonia. An older child will tend to have more what we call a localized kind of pneumonia, maybe affecting one part of the lung, called a lobar pneumonia. So one of the symptoms will be pain. They will tell you, I'm feeling pain here when I cough or when I breathe in. And not just pain, it will be accompanied by fever. It will be, now here, cough is there.
Yes.
You may not necessarily see the chest move, the chest going in and out, but a keen person will be able to see that the breathing pattern is faster. Yeah, but the good thing, the beauty of it, the child will tell you.
Yes.
And that is one type of pneumonia. But we do have other pneumonias where the child just coughs, but you may not necessarily feel pain. But because the cough is not going away, and you go see the doctor, when we listen, then we hear the breathing pattern is off. Yeah.
Okay.
Yes. But the pneumonias in older children are not as as bad. They're not good, but they're not as bad as for the infants.
Okay.
Yeah.
So that means as a parent, you really must be keen.
Yes.
You know, in monitoring your child.
Yes.
Yeah.
And listening.
Yeah.
You know, many times we take care of the infants and we are so keen. But with the playful kindergarteners, sometimes we just think they are disturbing. And do you know something? One of the symptoms of an ill child, some children will become dull, but others become extremely annoying. You know that child who is just throwing tantrums
Yes.
and rolling on the floor and refusing to eat. Sometimes they are unwell. That is how they are trying to cope with their pain. So it's very good to spend time with the children, listen to them, know your child so that when their behavior is off, then you know something is amiss.
Okay.
Yeah.
That's how. And you kept mentioning that, you know, pneumonia affects the lung area. So are you able to tell us what happens to the lungs when this child has pneumonia?
Yes, when you have an infection in the lung tissue, the process of infection is inflammation. So meaning that there is a lot of, the bacteria are causing damage to the lungs. So some of it is can even be by destroying the lung tissue, replacing it, destroying it, so you might have even pus. So when the lung tissue is destroyed, and this is what you are using to pass oxygen, taking oxygen from to the other tissues through the blood, then of course there will be pain. Whenever there is inflammation, there is pain, and then there will be lack of oxygen. So meaning that if we check your oxygen levels, they will be low. And if your oxygen levels are low, you also not going to your brain, so your conscious level will not be good, and your other tissues will be affected. If the heart doesn't get enough oxygen, it will not pump well. So it's a whole vicious cycle, and why you need to intervene. And when we do the X-ray,
yes,
now that's when we're able to see the changes in the lung. Because on an X-ray, the lung should appear black, because air on an X-ray appears black. Tissues appear grayish, and bones appear white. So when you see white or gray in tissue that is supposed to be dark, then you can see there are already some changes. The lung tissue is solidifying because, one, there is no oxygen going there, so there is no air in that lung. And two, if maybe the pneumonia has gone on for a while, already the normal lung tissue is being replaced by scar tissue, which now will appear a different color from what you'd see on the X-ray. And if I listen with my stethoscope, there is something I'm supposed to hear when I'm listening through normal lung tissue. I'm supposed to hear air going in and out. In. So in some sections, I'll hear nothing, or I'll hear harsh sounds as air is passing through some scar tissue. So those are the signs that we pick.
Okay.
Yeah.
Wow.
Yeah.
When you come back, I want to answer the question, is there a specific age, in children that is mostly affected by pneumonia? That is after this break. Keep it right here at Hope TV. This is Health Check. My name is Grace Mutiso. I'm hosting Dr. Christine Shege, a pediatrician and a pediatric infectious disease specialist, helping us discuss this topic of pneumonia in children. Remember, when you come back, 22232 is our SMS line at Hope TV Kenya. On Facebook and YouTube, will be sampling some of your questions. Keep it right here.
Last week on Testify.
Kwenda kupiga kona hivi vitu tunasikia waizi ndia waizi. Nikaachilia TV chini. Tukapenya hivi unajua vile tuachilia zile vitu chini ilisaidia. Sasa wale watu wakoma tu kwa zile vitu.
Watch part 2 of Frederick Otieno's testimony on how he was reformed and got born again.
Na maisha yako kutoka ubadilike ukiangalia nyuma, yani unaonanga Mungu alikufanya nini?
Mungu, nilianza nikisema wacha Mungu aitwe. Wacha Mungu aitwe. Mungu akisema atakubadilisha, atakubadilisha. Na ukimrudia anajua roho ile inaweza mrudia. Mungu hujua roho ya mwanadamu.
Only on Hope TV. Look and live. every Wednesday at 7:30 p.m. Spotlight.
Do you feel like they are in a place where they can effect a Barack Obama moment?
When you hear the word of God and you hear Jesus is speaking,
Real talk on real issues.
You know, the Bible says faith without works is dead.
The truth of the gospel that will survive the time is not a health and wealth gospel.
When there is time to harmonize and bring one composite amendment.
With idealistic, thought-provoking guests.
So people come to be serviced, to be encouraged, to be empowered.
When the storm is over, you desire the closeness you have with God.
Hosted by Reverend Edward Furi.
You're still on Healthcheck right here, Top TV, Look and Live. My name is Grace Mutisa and I'm hosting Dr. Christine Shege, a pediatrician and a pediatric infectious disease specialist. And in a short while, we'll be getting to your questions. Our SMS line is 22232, that is 22232. You can also get us on Facebook and YouTube. By the way, we are live. Share this content with someone you know who needs to get to learn about pneumonia in children. And of course, you can drop there your question or comments and we'll be getting to that. So Dr. Christine, we promise when you come back, you'll be letting us know, is there a specific age where it's common, you know, that children are affected by pneumonia?
Good. The younger the child is, especially those before vaccination. You know, vaccination for pneumonia starts at 6 weeks. So sometimes we may have some children getting pneumonia before that age. But basically, before 6 months is a common age for pneumonia. And another reason for that is because influenza, like I said, is now a leading cause of pneumonia. Influenza, RSV is also a leading cause of lower respiratory infection, the one I called bronchiolitis, which sometimes we cannot differentiate from pneumonia. So that age before 6 months is a very high age for pneumonia. But basically before the age of 2, that's a high risk age for pneumonia.
Okay.
Yes.
Hi. I'll ask a sample a few questions that have come through from our viewers. On my SMS line 22232, I can see one of the listeners saying, "Hi, Dr. My son is 7 months and has a wheezing sound early morning hours. Is it an allergy to watch out as per the doctors, or there is more to this? It started in August."
Yes. Now, that may be two things. One, it may be an allergy, like she says, because some of the allergies develop early in life. And what do we mean by allergies? Allergies, let me specifically dwell on the airway allergies. The airway allergies, I think we mentioned that our airway starts from our nose, goes down our upper airways, goes down to our lower airways, where the trachea or the air pipe divides into two, to the bronchi and to the bronchioles. So if you have allergy affecting any of those airways, we give it a name. So if it's affecting the upper airway, we call it rhinitis. If it's affecting the lower airways, we call it asthma. But maybe people don't like hearing the word asthma. Because it has a lot of connotation. It's a stigma. I don't know why it is so stigmatized. But if I tell them you have allergic airway disease, they're very happy with that. Even if I give you an inhaler, they will take it. Just don't mention asthma. But asthma is when you have allergy in your lower airways, it is called asthma. So wheezing can be a sign of asthma, childhood asthma. Or wheezing can also be as a result of a virus. Remember I mentioned bronchiolitis.
Yes.
When you have your lower airways not open enough for air to go in smoothly and out. It's like you're blowing in through a very narrow pipe. You will always have an abnormal sound.
Yes.
So that can be as a result of a virus, which may either be acute or because the virus has gone, but your airway has not completely gone back to normal, the wheezing may linger on for a while and then eventually go. So it's difficult for me to differentiate here on air between the two.
Okay.
Yes.
So should this parent take the child for a second opinion or just go for?
Well, it depends on who is, if she's satisfied with the progress and the explanation, and the wheezing is coming down. It's just that it's taken time. I think depending on who is treating, they should just follow the advice of the clinician. Yeah.
Okay. This one says, thank you, Daktari, for the great work in educating us. Can a house with molds cause asthma in small children?
Oh, yes, that's a very, very good question. Because mold is a fungus. Yeah. So, and that, when you inhale the spores from the fungus, they can go, and you know they are very tiny. So that you will bring them in, they will not linger in your upper airway, they will go down. So they will start triggering allergic reactions. So if you live in a house that has mold, either move out or get it treated, get the mold gotten rid of. Yeah, because mold is dangerous.
Okay.
Yeah.
One more, Dr. Christine. My name is Doreen. My baby is 2 months old. She loves sucking her thumb. What could be the problem? And she sneezes now and then.
Well, that one has just sneaked in an pneumonia question, but I know that...
maybe she's a first-time mom.
Self-soothing.
Yeah.
Self-soothing.
Yeah.
Maybe self-soothe by either you give them a pacifier, which they suck on. If not, they will suck their thumbs. Some others have some special blankie or something, which they carry around and suck on. So it's just a self-soothing behavior that there's nothing we can do.
Is it dangerous? Does it
No,
have
it is
any
not.
effect?
It is just annoying because you don't want your baby to suck their thumb, but there's nothing you can do.
I've had, if a child sucks their thumb for so long, it will affect their teeth.
Yes, it will.
It will. So that's true.
Yes, that's true. But is that dangerous? You'll just have the teeth aligned when the child stops sucking the thumb.
Even if it's at 10.
Yeah, and I bet you, like, when the child starts talking and understanding, the age of reason maybe starts at 7.
Yes.
You can talk them out of sucking their thumb. But before then, I wonder what you're going to do to this 2-month-old.
Nothing.
Nothing.
You remove it, they take it back.
Of course. And it's their thumb. It's not yours.
I hear you. So, Mama, settle. This one is asking, Daktari, I'm watching from Kasaranias. Daktari, how do you differentiate respiratory
RSV?
Syncytial virus and influenza in young children? That is Edward.
You have to do the tests. Yeah. So as a mother, you will not differentiate, definitely. So you have to go to, some hospitals do the test, which is like the COVID test. You use the same nose thing, and you do the panel, you test for the viruses.
Yes.
Otherwise, even the influenza itself can cause bronchiolitis. And even the RSV itself can cause pneumonia. So it's you can't say, let me differentiate. But when because they are both viruses, you will basically not be giving antibiotics to both of them. You'll be treating what you can see.
Yes.
So when I examine this baby, what can I see? I can see that this baby can't feed. So what will I do? I'll give them fluids, or I'll put a tube and give them milk through the tube. I can see this baby has low oxygen. So what will I do? I'll put them on oxygen. So you treat their symptoms. So it doesn't matter if it's influenza or if it's RSV, just go anywhere. It's not even you have to go to a sophisticated hospital. Even the county hospital. I work in Kiambu. We have children with RSV and influenza and pneumonia, and we treat them in exactly the same way we would treat them in a high-end hospital, without the flowers, of course. Yeah. But
you're funny.
It's true. We don't have the paraphernalia of
that Puts them
and
ambiance.
patting the mothers like this.
Yeah.
But we have the oxygen, and we have the fluids, and we have the injections, and we have the tube to feed the baby, and they all do well.
And they heal and they go back home.
And they go back home.
Okay.
Yeah.
Please take your child to the hospital and be checked. Sawa. Afrida is asking, I have a 6-month-old baby, and of late he sweats a lot at night. So I must change his vest at midnight. Just asking, can night sweats cause pneumonia?
That's a good one. Remember what we said? That pneumonia is not caused by cold. Pneumonia, and then I'm glad that question has come up.
Yes.
By the way, it's a very good question. So what I would like to say is that the reason one of the reasons we associate cold with pneumonia is because many of the viruses multiply during the cold season.
Yes.
That's why you see influenza comes up during July. So during the cold season, there's a lot of respiratory illness. That is one reason, because viruses multiply in the cold season. The next reason, during the cold season, we keep our windows closed.
Yes.
So we never have circulation of air. So if there is anybody in the house with an infection, it is trapped in there. And everybody gets to share, get a share of the infection. Another thing I want to say about the night sweating, and many babies sweat, and they are healthy babies. But how do we make it worse? By overdressing them. So what is the rule of thumb? If you yourself are not sleeping with 10 blankets, please, your baby is also a mammal. They are not a reptile. They are not cold-blooded. So can you, if you remove one layer, also remove from the baby.
A layer.
Yeah. So even I see mothers carrying babies with blankets in the streets. And I'm thinking to myself, blankets belong in the beds. So if you yourself did not wear a blanket to come, why on earth are you wrapping your baby in a blanket and taking them out? Or even during breastfeeding, you see, you eat when you are just watching people. Yes. But you want your baby to eat under a blanket. So sometimes it's just a bit, I don't want to say common sense because that's insulting people, but I just want to say babies are mammals, by the way.
Yes.
From birth, they are mammals. So they are warm-blooded. They are very well able to regulate their temperature.
Yes.
So if the sun is out, it means if you are feeling hot, they are also feeling hot. So you also unclothe them. And remember also, these respiratory illnesses are by inhalation.
Yes.
So covering the baby with blankets and the nose is clear, they're still going to inhale. So unless you're also going to cover their noses, so let's relax.
Okay.
That, yes.
I just know if you know, I'm sure many mothers are feeling guilty.
Yeah.
You know, we like covering them. You know, anajifunua sana usiku. So you add more blankets and you tuck it in proper.
No,
so that they don't feel cold.
There's a very small, now here I'm talking as I don't say former mother,
yes,
but as a former mother of infants.
Yes.
Because now my children are big. You can dress them up in, what are those clothes called?
Rompers.
The ones that they even if they turn with the clothes.
Sleeping bag.
And by the way, a sleeping bag is better. You know why?
Yes.
Because the sleeping bag some of them don't come with sleeves. So it means you put the baby in, but they are wearing something warm. And then if you need you feel it's hot, you just unzip one side.
Yes.
And then it's when you tuck in your baby and cover them and it's really even you try to tuck yourself in and you can't move, you're sleeping like, who even sleeps like this? Yeah.
So they should not blame it on pneumonia. Please allow the children to breathe, mothers.
Yes,
okay.
yes, please. Yes.
Please keep your questions coming on 22232. We still have some few minutes to go. That is 22232 or at Hope TV Kenya, and we'll be sampling them. So let's talk about some of the risk factors of pneumonia in children.
Okay, so some of the risk factors, and one big one is maybe a child who was born before term. So when you're born before before term, your immunity may not be fully developed. So you may be at risk of not being able to fight off bacterial infections.
Yes.
Another risk factor for pneumonia is if you're born with certain immune deficiency conditions. When I say immune deficiency, people rush to AIDS. No, I'm not talking about HIV, AIDS.
Yes.
Talking about some immune systems, I will call them congenital, that you're born with. The child basically is born with an non-functional immune system. So they are prone to infections right from birth, and one of the infections is pneumonia.
Yes.
What other condition can put a child at risk of pneumonia? Malnutrition. And when I say malnutrition, I know people have that child in the textbook whom they see who only eats maize and is having a big stomach. No. Malnutrition sometimes is not even a socio-economic issue. It is an ignorance issue. And unfortunately, as health workers, we have done a disservice to our clients, to our mothers. We are not giving them health education. We are not taking our time and telling them simple things like breastfeed your baby on demand. Take your baby for weight check every month until they are 1 year. Whether there is a vaccine
or not,
take your baby every month. We are not selling them. So when I see the child, for those who know the good things, we should tell mothers to do something because everyone wants the best for their child.
Yes.
So when I see a child at 4 weeks and I check their weight and I see it's not going along the curve, I will go back and look at the breastfeeding history. So if the child is off, that is already malnutrition. Yeah. And unless I put that child back on track, if they are malnourished, then their immune system is not working. So they will be prone to pneumonia and other infections. So that's another big one. What is another big? I know people are saying, isn't she saying cold? The cold is not there. Otherwise, everybody in Antarctica and Canada would be just falling off from pneumonia. So cold is not there. Yeah. So basically, it's a malnutrition, immune deficiencies that you're born with, and we say the preterm if you're born preterm, and then another big one is pollution. Yeah.
Break that one down for us.
Let me break down that one. By pollution, I'm talking of air pollution. What are the causes of air pollution? One is smoking. Of course, the baby is not smoking. So who is smoking? A household member who smokes. So secondhand smoke. Another one is the fuel we use for cooking. Yeah. So of course, not everybody will be able to afford the clean fuels, but you can, if you have, you can cook outside, you know, or not in this room where people are. You can watch. I know people steal food. If you leave it outside boiling, your githeri will go. But you might have to sacrifice and maybe employ somebody to, not employ, but one of the household members who is also going to eat. You tell them to watch the githeri out there. So try to cook away from the house. That's what I'm saying. Because those pollutants interfere with the clearance mechanism of the airway. So it doesn't work well. So the bacteria and everything else gets trapped. Another cause is overcrowding. And unfortunately, we cannot do much about the overcrowding given our economy. There are just a few things that we can do, like keeping windows open. But you know, sometimes you're keeping windows open and whatever is coming in is, but overcrowding is a risk factor for pneumonia. Yeah, because of, so that also tells me that we should do as much as possible to even if you're going somewhere with a baby. I know we like to go to church, we like to, but go to a well-ventilated place. By the way, I get so happy when I see a mother who is selling some groceries and things, and her baby is right there next to her. Because I am thinking this baby, especially if it's outside, this baby is getting vitamin D.
Yes.
The baby is breathing in God's air. This baby is boosting their immunity by all these exposures. And this baby's mom is right there. So snack time, everything. Rather than the baby who is left under the care of somebody who basically keep them indoors and feed them on something that we do not know. Yeah, so those are just, it's good to get creative. We should now not look at our limiting things and think, oh, you know, me, I'm poor, I live in this, and get creative. Yeah.
Okay.
Yeah.
Sawa. Then could you share with us how diagnosis is done and the treatment for pneumonia in children?
Okay. So diagnosis, we already alluded to it because diagnosis starts from the signs.
Yes.
Because you know, when you go to the doctor, they will basically ask you, you basically say the child was coughing or they were having difficulty. In fact, what people say is difficulty in breathing.
Yes.
So you ask them, alikuwa na hema, they were panting. What else did you see? They were not being able to breastfeed. So you ask them, and then they may tell you they had a fever. So you examine. Of course, the one thing we do, we count the breathing rate. If it's more than a certain number, depending on age, you're able to. And then, of course, looking at the breathing pattern, that is something a medical student should be able to do.
Yeah.
Basic medical, whatever, skills should be able to pick up pneumonia. Yeah, so you count the breathing rate, you check the breathing pattern, and then lastly, you put your... By the way, the stethoscope is not even that important. You can be able to make a diagnosis in an infant without even the stethoscope.
Yes.
Because some of those are not out there. So then now, when you make a diagnosis, by the way, you don't even rush to a chest X-ray. A chest X-ray you do if you are suspecting there are complications or the child does not respond to treatment, in the initial treatment, because babies respond. If it's bacterial pneumonia and you give antibiotic, they respond very fast. Yeah.
Yes.
But you must also support them with, if their oxygen is low, you must give them oxygen. If they are not feeding, you must give them fluids. So support their care and give antibiotics. For viral pneumonias, it's basically supportive care because viruses, the body is able to fight them. Yeah, so the most important thing is if you see a sign in your child that you don't like, those ones that I've mentioned, child not feeding, child looking dull, abnormal breathing pattern, don't try to be a doctor, yeah? Just go to the nearest hospital, let somebody check it out for you.
Yes.
Yeah.
Let's repeat about, giving the cold syrups, which you said is a no-no.
Yes.
I know there could be a parent who just joined the conversation now, and you've said categorically that's a no.
So now when we come to treating, let's talk about respiratory infections in general. You have to understand what are respiratory infections, why do we have cough, what is the mechanism of cough. Cough is basically a clearance mechanism.
Okay.
So when you cough, of course babies do not spit. What do? They swallow and sometimes they vomit. So if you examine the vomit, you'll actually see mucus. And even the mom may tell you, after they vomited, they slept.
Yeah.
And the breathing pattern normalized. So we do not want to stop the cough. Because what do cough syrups do? Cough syrups, what they do, they suppress the cough. So when you suppress the cough, you have not eliminated the cause of the cough, which may have been mucus trying to clear. So you give a cough syrup, you suppress the cough, and then a few days later, you just see the child's breathing pattern has changed because all that mucus that was trapped in is still there and now is affecting their breathing. So we should not, if you think this cough is too much because the baby cannot feed, go to the hospital. Because most of the time what will happen, if the doctor examines and listens, they'll be like, oh, maybe you have pneumonia, let's give antibiotic. Oh, you're wheezing, let's give this treatment. Oh, you have this. So let the doctor be the one to decide what to do. Because the over-the-counter, in fact, most of the time when you get over-the-counter medication, you're not even accompanied by the child. In fact, it's usually on your way home, you are called by the person at home. Then you go to the chemist. my child is coughing. What do you think would be a good? They ask you, how old? Say 5. Now, a 5-year-old can be 20 kilos.
Yes.
A 5-year-old can be 14 kilos. A 5-year-old can be 30 kilos. So you just say they are 5. So if you tell them, give me an antibiotic, then they don't, you know, antibiotics are many for treating different things.
Yeah.
So you go with it, you go with a package, start giving your child, it's not working, child gets worse, you know. So some of these things, yeah, let's agree to be inconvenienced and go to the hospital. If you, by the way, county hospitals are very good. It's just that for some reason, we Kenyans, and especially Nairobians, we are afraid of queues.
Yeah.
We are afraid of queuing. We should not be afraid of queuing.
Yes.
Just queue. You will eventually be treated.
Okay.
Yeah. Yeah.
So, and as a parent who's taking care of this child who's been diagnosed with pneumonia, what are some of the do's that we need to take care of?
For the do's, when you have already seen the doctor and they told you this is what you do,
yes,
do what the doctor has said. That's the first do. Take the antibiotic. When we say the antibiotic is twice a day, it does not mean asubuhi at breakfast and at lunchtime. It means a day is divided into, if you divide a day into 2, it means every 12 hours.
Yes.
So if you give the first dose at 8 a.m., the next dose should be 8 p.m. So that is the first thing, adhere. If the child gets better, but you are told the antibiotic is for 5 days, please do not stop. Finish the dose.
Yes.
Set a timer. Do whatever you must. If you are told this medicine must be kept in the fridge, do not remove it because you know that phobia of cold. I don't want the baby to drink a cold thing. I don't know what, it will cause pneumonia. And anyway.
And we are treating that.
Yes, you give from the fridge, put it back. After all, you're giving 5 ml.
Yes.
Yeah, if you feel, hey, this is too cold, just maybe let the child drink some warm water for your own psychological satisfaction, not for the baby's. Yeah, yeah. So give as it should, store it as it should be stored, give the dose correctly, finish the dose. Yeah, basically, I can't. And then if you've been told to have a review,
yes,
you know, sometimes you tell them the child is very sick, but you tell them come after 24 hours so that I can see. You need to turn up. Or if I tell you, I give you a paper and I write, if you see this sign, come back immediately. You do exactly what you have been told.
Yeah.
Yes, those are the do's.
Obedience, in short.
Obedience to the instructions.
Okay.
Obedience. Yeah.
Can it clear on its own? Can pneumonia clear on its own?
If it's viral, and it was mild, it will clear, but you do need to get checked.
Okay.
Let the doctor be the one to tell you this will clear on its own.
Okay.
Yeah.
Thank you. Thank you. Thank you, Dr. Christy. You're putting short to parents who are watching in regards to, you know, taking care of their children in relation to pneumonia. What would your parting shot be?
So my parting shot is, do not fear pneumonia. I've already told you the things to look out for. And it's not that you go looking for them. I said look out. I didn't say look for. I said look out for. If you know your baby well, and you know, as mothers, we know our babies because they were with us in the womb for 9 months.
Yes.
And when they come out, we bond with them. When we are breastfeeding them, so when something is off, you automatically know. So don't fear, like keeping on thinking that smallest cough is pneumonia. I said the signs of pneumonia is breathing problems, inability to breastfeed. So take that child to hospital. And how will you protect your child? Not only from pneumonia, but from infections. Breastfeed your children. Yeah. Avoid indoor pollution if you can. Like don't have the windows open. Don't smoke in the house. And basically, if you are using a fuel like firewood or jiko or stove, use it outside the house. Or in the room where you are, keep the door closed and the window open. Na ukipoesha, uipoeshe nje. So yeah, those are and vaccination.
Yes, vaccination.
If you
At
can,
what month?
so the 6, 10, and 14 weeks, those ones are free. Influenza vaccine, unfortunately, is not free. But if you can afford, it's given to the babies at 6 months. And if you want to go a step further and protect your baby before 6 months, get influenza vaccine when you're pregnant. Yes.
Okay.
Yeah.
Makes sense. Thank you, Dr. Christy. Really appreciate you. Thank you for your time. Thank you for educating us. And may the Lord bless you and refresh you as you refresh others. She's called Dr. Christine Shege, a pediatrician and a pediatric infectious disease specialist, helping us discuss this topic about pneumonia in children. I hope you've learned, on my take home as a mother, and I know you're also watching, stop of addressing that child. They are mammals, just like you and I. Allow them to relax, And please take your child for a checkup in case you notice anything that is not usual. Have a beautiful, beautiful evening and keep it Hope TV, look and live. God willing, we'll do this again next week on Tuesday. Watch out for a repeat of this program. That is tomorrow from 11 o'clock. And of course, stand by for Chiriku. And after that, Grace Wangoi joins you on Newswatch. Have a beautiful evening. Shalom and God bless.